Imagine this. You have a splitting headache that won't go away. No painkillers. No hospital. No doctor with a medical degree. So what do? If you lived 7,000 years ago, someone might have picked up a sharpened rock and drilled a hole directly into your skull, while you were still awake. And here's the part that should genuinely shock you: a lot of people survived this. Before modern medicine, getting sick or injured wasn't just uncomfortable, it was often a death sentence. No antibiotics. No X-rays. No sterile tools. And yet, ancient humans didn't just sit back and let nature decide who lived and who died. They experimented. They observed. They developed surgery techniques thousands of years before anyone understood what a germ even was. Some of what they figured out is so advanced, it still surprises modern doctors today. Let's start with the most shocking one. This procedure is called trepanation, deliberately removing a small section of skull bone. Sounds terrifying, right? But archaeologists have found trepanned skulls on nearly every continent, some dating back over 7,000 years. And here's the detail that changes everything. Many of these skulls show clear signs of bone regrowth around the hole. That means the bone was healing. That means the patient didn't just survive the surgery. They lived for months, sometimes years, afterward. Ancient healers likely used trepanation to treat severe head injuries, seizures, or unbearable pressure inside the skull, and in some cases, it may have actually worked, relieving swelling in a way that modern doctors still sometimes replicate with a very similar emergency procedure. The tools were simple. Sharpened flint or obsidian, scraped or drilled slowly by hand. No anesthesia as we know it, though some cultures likely used natural plants with numbing or sedative properties to dull the pain. So how did they deal with pain and infection, without a single modern drug? Nature, it turns out, was already stocked with a surprising medicine cabinet. Honey was one of the most widely used treatments across ancient cultures. It's naturally antibacterial, its low moisture content and acidity make it incredibly difficult for most bacteria to survive in. Ancient healers packed it directly onto wounds, and it likely helped prevent infection more than they probably even realized. Moss and certain plant fibers were used as early wound dressings. Some types of moss have natural antiseptic properties and were even used far more recently, during World War I, when medical supplies ran short. And for pain, certain plants containing natural compounds, ancestors of ingredients still used in modern painkillers today, were chewed, brewed, or applied to dull pain and reduce swelling. None of this was random guesswork forever. Over generations, healers learned what worked through trial, error, and careful observation, passing that knowledge down long before anyone could explain why it worked. Broken bones were common and deadly, if handled wrong. A poorly healed fracture could mean permanent disability, or worse, in a world where you needed full mobility just to survive. So ancient healers developed surprisingly effective splinting techniques using wood, bark, and tightly wrapped bindings to hold broken bones in place while they healed. Some ancient splints found by archaeologists show remarkably similar structure to modern splints used today. But here's the part that really surprises people: ancient humans didn't stop at healing. They innovated replacements. One of the oldest known prosthetics is a wooden and leather toe, found on a mummy in Egypt, dated to around 3,000 years ago. Where patterns on the prosthetic suggest the owner didn't just wear it for appearance, they actually walked on it. Think about that. Thousands of years before modern prosthetics. Someone built a replacement body part that genuinely worked. Surgery wasn't performed by just anyone. Most ancient societies had dedicated healers, people who specialized in treating the sick and injured, often passing their knowledge down through apprenticeships that could last years. Some ancient civilizations even had structures resembling early hospitals, dedicated spaces where the sick were brought to be treated and to recover, separate from everyday living areas. This wasn't random luck. It was structured, developing medical knowledge built entirely without microscopes, textbooks, or formal science as we understand it today. Here's the detail that still puzzles researchers today. In some ancient sites, studies of trepanned skulls show survival rates as high as 70 to 80% for a skull surgery, performed with stone tools, with zero understanding of infection. For comparison, during the American Civil War, thousands of years later, Similar head surgeries had a survival rate far lower than that because doctors at the time still didn't fully understand the importance of sterilization. In other words, in some cases, ancient Stone Age healers may have had better outcomes for this exact procedure than surgeons did thousands of years later, with metal tools and formal training. It's a strange, humbling reminder: knowledge doesn't always move in a straight line. Sometimes we lose things before we find them again. So the next time you take an aspirin, get a cast on a broken arm, or walk out of a hospital after surgery, remember there was a version of this happening long before written history, with stone tools, natural remedies, and nothing but careful observation passed down by word of mouth. Modern medicine wasn't built from nothing. It was built on thousands of years of people who refused to let pain and injury be the end of the story. If you want to know what happened when ancient humans got sick with something they couldn't cut out or treat with a plant, how they dealt with plagues and disease outbreaks with zero understanding of germs, that video's coming next. Subscribe so you don't miss it.